Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. We're going to talk about men's sexual health, a subject that has become more important over the last 10 years and especially over the last 5 years. But it's been an ongoing issue for men for decades. It's just something that was hard to talk about, I think. And that was because a lot of doctors and a lot of providers are uncomfortable talking about sexuality and sexual function, whether it's for men or women. And there was a misperception for many years that a lot of it was psychologic, when really it's biologic. So we treat a lot of men in my practice, have for over 10 years. A lot of them are husbands in the practice, husbands of my patients as a gynecologist, but a lot aren't. People come from all over to see us for this because we know what we're doing and have for a long time because we do so much sexual health medicine. So men have different problems. They can have problems with erectile function, they can have problems with orgasmic function, they can have problems with premature ejaculation, they can have problems with decreased libido, and that covers the main subjects, even though there's a lot of other ones in between. So our approach at Optimal Health Associates is to treat the whole person always. So if they're having a problem in one area, sometimes it's bleeding over into other areas, or there's a cause that's affecting more parts of them than just their sexual health. So we take a complete analysis of the person and then try to structure a plan that's going to address their concerns or issues. One thing to keep in mind about sexual medicine, if we think about the 90s, with ED, it was all about Viagra. Whereas in 2021, yes, we still use those types of medicines for ED, but we actually try to find solutions. And so we have different modalities, things from minimally manipulated mesenchymal stem cell derived products that we may use to ultrasound therapy, to oxytocin, to hormones, to all kinds of things. So we have a whole slurry of stuff to fix problems related to sexual function in men. Most of them are reasonably easy to use. Some are covered by insurance, some are not. And that's just the way it is. But we can usually find solutions for most guys. Because if there's a problem with erectile function, it's usually going to be something with either the arteries flowing blood in or the veins collapsing to keep the blood in, because they have valves and they have to do that. If it's premature ejaculation, it has to do with serotonin levels. So that's really pretty easy to fix most of the time. And then if there's problems with ejaculation or other things, we do our best to get those patients taken care of. So we're always accepting patients for those related issues. So that's just a brief summary, and there's specific choices in terms of what we're going to do that are very advanced and helpful for people. But again, that's going to take some one-on-one time in terms of talking to me or one of my fellow colleagues at the office to get your plan figured out. So male sexual health, happy to help you with it.